This is A Drink with the Hurricane, the talk show discussing all things growing your home care business.
So, how are we going to create this? The first question you need to ask yourself is, what type of business are you looking for? What are you set up for? What are you good at? What can you staff? What do you want? For instance, when I was coaching with Steve, I created, and I'll show you a little bit and you can take a picture of it or whatever, but I created an extended care program. It was not one of the top 10 leading causes of death. We had those as well. But when I was thinking about what type of business are you looking for, we had 8 overnight caregivers that were available for shifts. I needed to find work for them. So when I went out and presented and did lunch and learn in services over our extended care program, we got 12 and 24-hour clients. You know why? Because our extended care program focused on 12 and 24-hour clients. We were set up for it, we could deliver it, we could staff it just like that. So maybe you're not at that level yet, but maybe you could do move-ins. You can help with a move-in package for clients, or maybe you can help transition them from hospital to home or rehab to home. So what can you handle? And what are you looking for? You do not want a service failure. If you have a service failure with your first client, Steve already said you're going to have a very hard time getting back in there and getting a referral from them again, or you're going to have to work really hard to do so, and we don't want that to happen. So you want to make sure that you're appropriately able to take these things. Now, how are we going to create this? You are going to follow your standard operating procedures. We're just going to talk about things a little bit differently. I don't ever want something to happen where you as a business development rep is out there marketing to your referral sources, telling them you have this stroke program, telling you have a dementia care program, and then the inquiry calls and your scheduler or whoever's in the office takes the call and all of a sudden says, we have to do the dementia care program, or I don't really even know what our stroke care program is, worse yet. It's not going to be that way because your standard operating procedures are your specialty program. Who here does a needs assessment? Everybody should be doing a needs assessment. And that is how you are going to tailor it to dementia specific or stroke specific, because you find out the individual needs from your client during the inquiry call and when you're in your home for your living room visits or in-home visits. The other thing you want to do when you're creating these specialty programs is researching data, use supporting data, and make sure that you're looking it up from referral sources that are trusted. So like the CDC, any university studies that you come up with, physician findings, New York Times, Forbes articles, all of those are good things to research, cite, and quote. Okay, so here's exactly how we're going to do it. We have a template that you can use to create your specialty program. And you can also change things up a bit for each of your specialty programs. So in the insert photo, you can use some sort of stock photo or something to put there. But you're going to talk about the problem up in the corner. Now, I guarantee your referral sources know that falls are a problem. So you're not going in there teaching them that falls are a problem. You're just going in there and confirming what they already know with this supportive data. That, I don't know, 60% of people are more likely to fall, have a secondary fall. I don't know all the stats without looking at the actual program. But you're wanting them to get in that yes mentality. When you're saying something and it's resonating with them and they're shaking their head yes, you're kind of putting them in that thought process to be able to say yes to you when you're asking them to give you a try at sending referrals. So that's what you would research, putting all your statistics there. And then you want to explain how you as a company are the solution to all of those things.